A 28-year-old hiker swept a remote cabin for 2 hours. This is what happened to his lungs. Presenting to the emergency department with a fever of 102 degrees Fahrenheit and a heart rate of 125 beats per minute. With an oxygen saturation plummeting to 85%, the patient appeared to be in the grip of a standard pneumonia. However, the rapid onset of severe myalgia and a hematocrit soaring to 55% revealed a much darker pathology. We are tracing the silent window of a viral invasion that turns the body's own immune response into a lethal internal flood. The patient, a fitness enthusiast in peak physical condition, arrived at the hospital 3 weeks after his hiking trip. For 21 days, he felt invincible, unaware that a microscopic clock was ticking inside his chest. This was the incubation period, followed by the prodrome. The term prodrome comes from the Greek pro, meaning before, and dromos, meaning running. It represents the period of early symptoms running before the onset of a specific disease. He initially dismissed his exhaustion as a lingering effect of a grueling trek, but the pain soon became localized. He experienced intense myalgia, from myo, meaning muscle, and algia, meaning pain, radiating through his thighs and lower back. This was not the dull ache of overexertion, but a deep bone-grinding soreness that signaled a systemic inflammatory response. Clinicians were initially concerned by the patient's blood profile. His labs showed a profound thrombocytopenia, from thrombo meaning clot, cyto meaning cell, and penia meaning deficiency. With a platelet count crashing below 150,000 per cubic millimeter, his body was losing its ability to maintain vascular integrity. The medical team questioned his recent history, uncovering a critical detail. 2 weeks prior, he had spent 2 hours dry sweeping a long-abandoned mountain cabin. This mundane task caused the aerosolization, from air meaning air, and sol meaning solution, of dried rodent excreta. In the dust clouds, he inhaled microscopic particles of the Sin Nombre virus, carried by the deer mouse. Imagine a single gram of dried waste containing millions of viral particles, each one smaller than a speck of smoke. These particles easily bypass the natural filters of the upper airway to lodge deep within the lung tissue. As the patient was placed on high-flow oxygen, his lungs were not just inflamed, they were failing. This was because the virus had begun a systematic dismantling of his vascular walls. To understand why he was suffocating, we must look at the endothelial cells, from endo meaning within, and thale meaning layer, which line the interior of the pulmonary capillaries. The virus targets these cells, triggering a chemical cascade that leads to the phosphorylation of VE cadherin. Think of VE cadherin as the molecular glue holding the vessel walls together. When this glue fails, the tight junctions between cells uncouple. The solid pipes of the circulatory system begin to function like a screen door. This is a catastrophic breach of the blood-gas barrier, the delicate interface where life-sustaining oxygen enters the bloodstream. Physiology dictates that if the barrier fails, the pressure will push fluid through. Plasma, the liquid portion of the blood, began to pour out of the vessels and into the alveoli. This is from alveus, meaning a small hollow, the tiny air sacs meant for gas exchange. This is non-cardiogenic pulmonary edema. The cardiac output remains high as the heart beats faster to compensate, but the endothelial lining of the pulmonary capillaries has become porous, allowing fluid to bypass the barrier. Albumin and heavy proteins escape the vessels into the alveolar spaces, effectively flooding the air sacs with the patient's own blood volume and blocking gas exchange. On a chest X-ray, his lungs appeared as a ghostly white out, a sign that the airspace was entirely replaced by fluid. Because so much liquid had leaked into his lungs, his remaining blood underwent severe hemoconcentration. His hematocrit, from hemato, meaning blood, and kritos, meaning separate, rose to dangerous levels. His blood was no longer a free-flowing liquid, but a thick, viscous sludge that his heart could barely move. As the blood thickens from fluid loss, the red blood cell count reaches critical levels, forcing the right ventricle to push viscous, sludge-like blood through constricted lung tissue. By the 12th hour in the intensive care unit, the patient entered a state of total systemic failure. As the plasma exited his bloodstream, his effective circulating volume vanished, leading to profound hypovolemia. This is from hypo, meaning under, vol, meaning volume, and emia, meaning blood. With so little fluid left in the pipes, his blood pressure bottomed out. His heart was now struggling against a circulating cardiac depressant factor, a chemical signal released during the inflammatory storm. This signal actively weakens the heart muscle's ability to contract. He was trapped in a cytokine storm. a self-destructive immune overreaction where the body's defense mechanisms begin to destroy healthy tissue. Cytokines and high concentrations of T cells flood the lungs, causing a hyperinflammatory state that damages healthy tissue as much as the virus itself. The clinical progression of Hantavirus Pulmonary Syndrome is notoriously rapid, often moving from mild flu-like symptoms to full respiratory collapse in less than 24 hours. In this case, the patient's peak fitness was a double-edged sword. While his strong heart could withstand the initial drop in blood pressure, his robust immune system likely contributed to the intensity of the cytokine release. Medical staff had to balance the need for intravenous fluids to maintain his blood pressure against the risk of forcing even more fluid into his already saturated lungs. This delicate titration is the hallmark of critical care in viral hemorrhagic fevers and similar pulmonary syndromes. The medical team's rapid identification of the rodent exposure allowed for aggressive supportive care. While no specific antiviral exists for Hantavirus Pulmonary Syndrome, the patient survived because his youth provided a narrow margin for his heart to endure the crisis. He eventually cleared the fluid from his air sacs, though he faced months of fatigue as his vascular junctions finally sealed. The recovery process was slow. As the endothelial cells repaired their junctions, the body had to reabsorb the liters of fluid that had escaped into the interstitial space. This required a careful balance of diuretics and monitoring to ensure his kidneys were not damaged by the thick, concentrated blood. This case serves as a stark reminder of the dangers lurking in undisturbed, rural environments. The Sin Nombre virus remains viable in rodent droppings for several days, and the act of dry sweeping is the most common trigger for human infection. Public health guidelines recommend a 10% bleach solution to wet down any suspected nesting areas before cleaning, which prevents the viral particles from becoming airborne. For this hiker, a 2-hour chore resulted in a 3-week battle for his life, illustrating how a single lapse in environmental safety can lead to a total physiological breakdown. Thank you for watching. To prevent future cases, the CDC recommends soaking rodent droppings in a 10% bleach solution for 5 minutes before wiping to ensure viral particles are neutralized and never become airborne. If this breakdown of the great capillary leak was helpful, please like the video, share your thoughts in the comments, and subscribe to Anatomy of a Mistake for more clinical deep dives. This is a composite teaching case for curiosity and education, not a transcript from a real chart, and not personal medical advice. See a licensed clinician about your own symptoms or care.